This will not be a harem scarum topic. That's an odd word. My wife and I pay $565 for our health insurance. The guy who cuts my hair, he pays $1,100. That's a lot, huh? He pays $1,100 per month. We pay $565 per year. Wow. Medications for us are generally free, unless it's an antibiotic, and then we'll either get it free or pay maybe $2 or $3. He pays a minimum of $15 for any prescription. And did I mention both of these are family plans? I pay $12 to see any doctor, specialist, primary care, anything. He pays $35 to see a primary care and $60 to see a specialist. If I need a referral, yes, I have an HMO. If they say I need to see a specialist, they say go get the phone book, find out where you want to go, make the appointment, call us back, and we'll get you the referral. Not your typical HMO type referral. I think our deductible for a family is $3,000, but I think it only applies if you go into a hospital. His family deductible is $7,500 from day one. Outside, well, that's for a family. There's 6 of them, so. Some of you know I'm getting older. Thinking it's screaming. Hush. I get shots in my knees annually, so I don't have to have knee replacement because I wanted to do squats all my life. It's typically a series of 4 visits, 1 evaluation, 3 sets of shots. You go back 3 subsequent weeks. I just had it done. The cost, what was billed to the insurance company, was $1,900. Okay, I paid $48, $12 per visit. He would have paid $1,500 for his deductible. He would have paid 20% of that $400 difference. So that's another, what, $80? Plus he would have paid $35 for each visit to the doctor. Why do I tell you all this? To brag about our insurance? No, not really. But what I want to do is just highlight some of the costs of insurance that are out there. 3 things I want to talk about. The Affordable Care Act, or commonly referred to as the President says, a term of endearment, Obamacare. Co-pays and deductibles, and some of the alternatives. The Affordable Care Act. Current and future law mandates that you must have health insurance, either through your employer, or you purchase it on your own, or somehow get that insurance. And you really have a couple of choices. I sell insurance. First choice, and I'm not trying to sell you any insurance. I really don't like health insurance. It's just it's commoditized. There's Medicaid. Medicaid, your co-pays are low. Your deductibles are pretty low, but you don't really have a lot of choice, and what you'll run into is finding doctors that will accept Medicaid. Not all doctors do, or they put a cap on the number of patients or the number of appointments that they have for Medicaid. You have group coverage. You can get it through an employer. My daughter is a nurse at Florida Hospital, and her insurance premiums, I believe, for a family is right around $650 per month. Plus, she still has the co-pays and must meet deductibles and all this other stuff. Then there's Obamacare. There's probably fewer doctors. From what I heard, most of the plans are HMO type plans, and there's differing levels of that. There's probably less choice if it's an HMO, but the costs are unknown. But a lot of times you will qualify for subsidies, and those subsidies will help offset some of the costs. There's a buddy of mine, his wife was ill. Prior to Obamacare, they couldn't even get insurance, but right now he says it's affordable at $200 and something per month. Next, if you get Medicaid, you must find a doctor that will accept it. Typically, you must have no assets and no money, and you go where you're told to go. With group insurance, you go through your employer, you'll have the deductibles that I mentioned, and you can generally have a lot more flexibility in where you go. But the premiums are a lot of times higher too. I've seen premiums $800, $900 a month. It's not uncommon on group insurance. Obamacare, you'll have a lower premium, If you fall within the required range, you can qualify for some type of subsidies, and it's better coverage than Medicaid. Your other option is you can do like the guy who cuts my hair. You can purchase it on your own and you can pay $1,100 a month. And I'm fine, happy selling him that all the time because I get a commission every month, every time he does that. Your premiums will be higher, but you'll have a lot more flexibility in where you go. It's typically a PPO, which means you can pretty much go wherever you want to go to see a doctor. The winner, in my opinion, outside of politics, is kind of Obamacare. Co-pays and deductibles. A co-pay is what you pay just to be seen, or it could be your portion of whatever that procedure cost, that 20% we talked about earlier. Deductibles are what you must spend out of pocket before the insurance takes over and starts paying everything. Full Medicaid, generally no deductible, no co-pays, but no options. Group, you have a lower copay, moderate deductible, and higher premium. Bless you. Obamacare, lower copay, moderate to higher deductible, but higher premium. Winner again, kind of Obamacare. Alternatives, you purchase it on your own, you can manage your copays, you can manage your deductibles, but you're going to pay for that flexibility, usually with the higher premium. I already told you our insurance is $565 annually, and he pays $1,100 monthly. My recommendation for the insurance is mixed. If you can get what I get it, but you have to go active duty military, stay for a long time. Hey, I pay the price. If you can get group has the most flexibility, but you can afford it. One thing my daughter told me that I didn't realize is that she really doesn't take the kids to the doctor when they get sick because she has to take each one to the doctor, so that's 4 different co-pays, 4 different medications, so something to think about. If money is an issue and you can qualify for the Affordable Care Act, go that route. You might as well apply for it because you're going to pay more in taxes anyway to support it, so you might as well do it. And one more thing, there's a lot of opponents to Obamacare and entitlement type programs out there. Some are in the room. Hey, I understand. And would you agree that's a fair statement? There's a lot of opposition.
Yes. Oh, yes.
Here's something to think about. I've worked with a lot of seniors, and I don't know a single senior that's opposed to entitlement programs who's on Medicare that would give the money back. So there's something to think about. When it affects you personally, then it'd be, oh no, this is my right. But when it's not you, you have a different perspective. So that's my speech, and now we're going to have a 2 to 3 minute Q&A period, and I'll try to answer any questions